Joining us this morning once again is Dr. Hamo Kauthry, the Chief Medical Officer for Dignity Health Central California Division. Good morning, Dr. Kauthry. Thanks so much for joining us.
Good morning, Alex, and I just want to let you know I'm joining you guys today from the Bakersfield Marriott at the Convention Center. They have a lot of specials going on for first responders, so if you're in town, you need somewhere to stay for a few days or a few hours, please call them.
Let's talk about that for just a minute. Of course, first responders on the front lines here and responding to this pandemic. It's not just here in Kern County, but it is, of course, everywhere across the world. But again, they're always on the front lines, but especially now they have that extra danger of possibly coming in contact with someone from who may be infected with COVID-19. Why is this so significant?
Well, the reason being, we as first responders, we have to continue doing what we're doing. We have to get out there on the front lines. We have to take care of the sick. However, we have to go home to our families as well. And we want to be extra careful that we're not passing this on to them as well. So we're taking extra caution, if you will, to make sure that we don't people that are our loved ones, really.
If someone is a first responder, they want to take advantage of this, what do they need to do?
Just call the Bakersfield Marriott. They're doing phenomenal work here. And I think it's great to see that the community is giving back. These businesses are giving back to the first responders.
Absolutely. All right, I want to move on to a topic that has captured the attention of a lot from a news conference that was held yesterday from a pair of local doctors at Accelerated Urgent Care. And they talked about that the virus, what we're seeing right now, since they say new data is coming in and we're getting a better sense of how this is affecting our community and the world, they are comparing it, they claim that this is comparable to the flu. Now, that goes against what a lot of other doctors across not just the nation but the world are saying. Is it fair to say that this is comparable to the seasonal flu?
As of right now, I would say absolutely not. We have seen the flu acts a lot different. This virus is a lot more virulent. It passes from people to people a lot more aggressively. The symptoms a lot more aggressive, and it seems to be affecting a lot of other age groups, which the flu typically won't affect.
Now, again, I mean, you're looking at the numbers and you're seeing how, take, for example, what we're seeing in New York and compare it to California. I mean, the two different scenarios here. Is it safe to say that this virus affects different communities depending on climate, depending on a variety of factors? Is it safe to say that?
I believe so. The difference between Kern County and New York, Manhattan, they're clustered there. The advantage we have in Kern County is we're spread out a bit. So, a little less likely for the virus to spread from person to person. But I think the bigger piece of it in this is what we did as a country, what we did when we found out what was happening in China and Italy, is we shut down. And I think that's what's really helped this virus from spreading so aggressively.
Now, the idea, though, is that they say, these doctors, were that the virus is widespread. And we've only been testing, even in Kern County, we've been only testing for a little more than a month now, and we have 692 cases confirmed here in Kern County. But we've even heard from you that it has said that this virus is widespread. It's been spreading for quite some time. Do you think that it is necessary for us to continue to stay at home?
I think we're coming to a close where we're not going to have to shelter at home anymore. The issue right now is we're at war. And, you don't give up your defenses right before the end of the war. I think that would be the worst thing you could typically do for something like this. I think we have this under control. Yesterday the governor made statements that he's allowing hospitals to do elective surgeries. He's letting things open back up again. So we're starting to see that happen. But I think if we do this too early, we would see disastrous effects from them.
One of the things that we've seen from the Institute of Health Metrics and Evaluation, that is the IHME study that a lot of people, including federal health officials, are showing, say that California has potentially one of the earliest dates to relax some of the social distancing guidelines. Of course, there's a lot of criteria that has to be met in order for that to to happen, and they say that we could relax some social distancing guidelines for the state of California as soon as May 17th. Do you think that is a reasonable date, as though the governor says that there is no date set at this time? Do you think May 17th is a possible set date?
I do. I actually initially believed it was going to be middle of June, but with the numbers coming down as they are, and us in California doing our part, being responsible, being sheltering at home, social distancing, I think we are seeing those numbers come down, and I think that May 17th date is very reasonable.
If you are young, if you are healthy, if you're not showing any symptoms of coronavirus, should you still continue to practice social distancing and stay at home?
You know, and that's, yes, the answer to your question is yes. And what we've seen is we have seen a lot of these people that actually have the virus up to 2 weeks before they even start showing symptoms are shedding the virus. We also know that there's 25% of the population that's asymptomatic that is shedding the virus as well. So we have to be diligent in what we're doing, and we have to stay the course at this point. We've come too far to change at this time.
So do you think that, hypothetically, if we were to go back to work today, go back to school today, do you think that we could reverse all of the progress that we've made?
You know, and it's not just me. I think, you know, the world leaders, the smart people in the world, the people that are governing us would say the same thing. That's absolutely right. If we go to school today, if we go back to work, we would have a huge relapse.
All right, Dr. Cothray, thanks so much for joining us this morning to give us a little bit of an understanding on the virus and how it's impacting not only us in Kern County, but around the world. We will see you tomorrow morning at 6:30 on 17 News at Sunrise. Take care of yourself, Doctor.
Thanks, Alex.